Okay. Still, we have a visual diagnosis inspections for toothache. The teeth are an extension of the bones and as much as governed by the kidney, while the gums are under the influence of the stomach. More specifically, the gums of the upper jaw are under the influence of the large intestine, and those of the lower jaw are under the influence of the stomach. The state of the teeth and the gums therefore reflects the state of the kidneys, stomach, and large intestines. For example, tooth cavities and loss of teeth may be reflect a kidney deficiency, and receding gums may reflect a stomach deficiency. Toothache. As a general rule, a full condition causes of toothache that is constant and intense, while an empty condition causes a toothache that comes and goes and is mild. Toothache that is worse in the evening and better in the morning points to yin deficiency, while one that is better in the evening and worse in the morning indicates yang deficiency. As far as channels are concerned, the upper teeth are influenced by the large intestine channels and the lower ones by the stomach channel. Excluding external invasions of wind, which cause an acute and temporary toothache, toothache may be caused by stomach fire, heat in the spleen and heart, damp heat, wind cold in the brain, and stomach and spleen deficiency. Stomach fire is a common cause of toothache, in which case toothache is accompanied by thirst, swollen cheeks, dry stools, mental restlessness, red tongue with a dry yellow coating in the center, and a rapid overflowing pulse. When the stomach fire combines with toxic heat, the toothache is very intense. There may be a fever, and the tongue could have a thick, dry yellow coating and red points. This may correspond to a tooth abscess in Western medicines. Toothache also may be caused by a heat in the spleen and heart, in which case there may be bleeding gums, insomnia, and mental restlessness. Clinically note, in Chinese medicine, the teeth are related to the kidneys and the gums to the stomach. However, there are teeth problems that are related to the conditions of the gums and therefore stomach. It would therefore be wrong to attribute these problems to the kidneys. Conditions of the gums are toothaches, sensitivity to cold or heat, and loose teeth. Damp heat in the stomach is also a frequent cause of toothache. It is usually accompanied by swelling of the gums. The relative importance of the toothache and the gum swelling gives an indication of the prevalence of heat and dampness. If the gum swelling predominates over the toothache, dampness is predominant. If the toothache predominates over the gum swelling, heat is predominant. The severe toothache that extends to the heat is due to wind cold in the brain and blood stasis, stomach and spleen qi deficiency may cause a chronic intermittent dull toothache and receding gums. This may be due to excessive consumption of sour foods. Toothache, invasion of external wind, acute toothache with headache and aversions to cold, stomach fire, intense toothache, thirst, swollen cheeks, red tongue, toxic heat, very intense toothache, very swollen cheeks, fever, red tongue with red points. Spleen and heart heat, toothache, bleeding gums, insomnia. Damp heat in the stomach, toothache with swelling of the gums and sticky taste. Wind cold in the brain with blood stasis, severe toothache extending to the head, stomach and spleen qi deficiency, chronic dull toothache with receding gums, stomach fire, toothache, especially on the lower teeth, mouth ulcer, full breath, intense thirst with desires to drink cold liquid, bleeding gums, burning epigastric vein, mental restlessness, dry mouth, dry stools, sour regurgitations, nausea, vomiting soon after eating, a feeling of heat, sour regurgitations, tongue red with thick, dry, dark yellow coating, and the pulse is deep, full, rapid. Damp heat in the stomach, toothaches, swollen gums, sticky taste, thirst with no desires to drink, a feeling of fullness of vein of the epigastrium, a feeling of heaviness, facial pain, stuffed nose or thick, sticky nasal discharge, nausea, a feeling of heat, dull yellow complexions, and the tongue is red with a sticky yellow coating, and the fall is slippery rapid. Stomachache deficiency with empty heat. Toothache, mouth ulcer, dry mouth with a desire to drink is expulsive, dull or burning epigastric vein, feeling of heat in the afternoon, dry mouth and throat, especially in the afternoon. Thirst with a desire to drink in a small sip, dry stool, slight feeling of fullness after eating. Night sweating, 5 palm heat, bleeding gums. The tongue is red, especially in the center only, without coating in the center. And the pulse is floating, empty, and rapid. We go to stomach and spleen qi deficiency. Dull toothache that comes and goes, weak gums, poor appetite, slight abdominal distensions after eating, tiredness, lassitude, pale complexions, weakness of the limb, loose stools, uncomfortable feeling in the epigastrium, lack of taste sensations, pale tongue, empty pulse. We go to heat in a large intestine. We notice a severe toothache, especially on the upper teeth, mouth ulcer, bleeding gums, constipations with dry stools, burning sensations in the mouth, dry tongue, burning and swelling in anus, scanty dark urine, thick yellow or brown or black, dry tongue coating, and full rapid pulse. Now we go to the damp heat in the large intestine, toothache, especially in the upper teeth, thirst with no desire to drink, mouth ulcer, a sticky taste, abdominal pain that is not relieved by the bowel movement, diarrhea, mucus and blood in stools, offensive odor of stools, burning in the anus, scanty dark urine, fever, sweating that does not decrease the fever, a feeling of heat, a feeling of heaviness of the body and limbs. Red tongue with sticky yellow coating, and the pulse is slippery and rapid. Now we go to the heat in the spine and heart. Toothache, bleeding gums, red lips, palpitation, terse mouth, and tongue ulcer, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste, burning epigastric and or abdominal pain, excessive hunger, red tip of the nose, dry lips, dry stool, and the tank is red with dry yellow coating, and the faucet is overflowing rough feed. We go to invasions of external wind, toothache, aversions of cold, fever, stiff neck, occipital headache, sneezing, other symptoms and signs, including those of the tongue and pulse, depend on whether it is wind cold or wind heat. We got to the wind cold in the brain. Severe toothache extending to the brain after an invasion of external wind that has not been cleared. Purple tongue. Thank you for listening.